Mm, 5 o'clock. Time to start. Okay, good.
Okay.
Good evening, everyone. Welcome to Dental Expert Insight Series. Learn from Luminous. And this has been brought to us. This webinar has been brought to us by Sensodyne GSK in association with Bombay Dental. And this is webinar number 4. And I present you Dr. Abhay Shukla, right in front of you. Hi, Abhay.
Hi, sir.
And Abhay has done his graduation from Government Dental College, Raipur. You can typically see a Government Dental College student. Extra talented. I know him since last 8-10 years. And super talented guy. Loves dentistry. Eats, drinks, lives dentistry all the time. You see him posting his cases and discussing dentistry. You talk to any subject in dentistry. Endo is his special love, but if you want to talk to him about implants, occlusion, prosthetic dentistry, he knows everything. Young gun, looks young, super talented. Okay, so he used to practice in Raipur before. Now he has shifted his practice to Ambikapur, Chhattisgarh. Please understand, in the world of social media, it just does not matter whether you're in Ambikapur, Raipur, or Delhi or Mumbai. It just does not matter. Everyone is same. It's just that you have that talent and you can showcase it to the world anytime you want, from wherever you want. He has his special interest in dental microscopes, and you see his images under the microscope, fantastic images under the microscope. Wow, amazing. So I keep following him. Especially for endo, and that's all.
My honor. That's my honor.
I have learned quite a lot from you, and you always learn from everyone, right? So
yes, sir. Yes,
okay,
sir.
all
that's a mutual thing, that's a mutual thing. Learning is a mutual thing. Okay. So Ajay sir has given a fantastic introduction. So as we all know that the pulp calcification is something which is a big challenge in day-to-day endodontic practice, right? So here I am in front of you all to present a webinar over the topic pulp calcification and its management. So I will start right now. Okay.
You can share the screen. Yeah.
Okay. So shall I start?
Yes. Go ahead. Okay. All yours.
Okay. So dealing with pulp calcification. Okay. I am Dr. Abhay Shukla. I'm going to present a webinar over the dealing of pulp calcification. I'll be telling you how to make such difficult cases easy. Okay. So what is pulp calcification? Pulp calcification is something which is very frequent finding, and histologically it is found in approximately 66% of teeth, and examined in person of 10 to 20 years of the age. It is found in 90% of teeth, and in person of 50 to 70 years of age, it is around 90% of person who are having such kind of calcifications. When viewed radiographically, it was found prevalent in 20% of teeth. Now, calcification has to be at least 200 micrometer in size to be visible on radiograph. Single tooth can harbor several masses of calcification. Okay. Now, when we come to etiology, it is basically unknown, but it is seen associated with some of the factors and the pulpal disturbances like tooth injury, attrition, abrasion, erosion, aging, and caries. Some of the clinical conditions like dentine dysplasia and Ehlers-Danlos syndrome also have pulp calcifications. Now, coming to the types of pulp calcifications, they are basically divided into two: the pulp stones and diffuse linear calcifications. When we talk about pulp stones, they are again divided into true and false pulp stones. Now these two both are divided into free, attached and embedded pulp stones. Now talking about diffuse linear calcification, they are linear strands of pulp calcifications, compulsory found in the radicular pulp, and they run parallel to the blood vessels. Now what is pulp stones? Always, this is also known as denticles. They are the localized masses of calcification present in coronal and root portions, most commonly found in the coronal pulp. Further, they are classified into true denticles and false denticles. When we talk about true denticles, they are localized masses of calcification that resembles the dentine in structure and have dentinal tubules in it and are lined by odontoblasts. They are most commonly found in coronal pulp and less in the radicular pulp. They are hypothesized that they are formed due to the calcification of trapped remnants of Hertwig epithelial root sheath. Now, what are false denticles? False denticles don't resemble the dentine and are concentric layers of calcified tissues. Calcification starts from the central nidus and that radiates outwards concentrically. False denticles are larger than true denticles and it can occlude the complete pulp chamber. Talking about further classification, then true and false are classified as free also, attached also, and embedded. Free denticles are something which is entirely surrounded by pulp tissue. Attached are something which are the calcified masses that is attached to the dentine either from one wall or two wall or multiple walls. Okay. Embedded denticles are denticles which are completely embedded into the dentine. Now, what is the clinical significance? Basically, when we come to clinical significance, there has been some reports linking pulp stones with the pulpal pain that can vary from mild to excruciating. The cause of the pain can be the stone impinging the nerve bundles inside the pulp. But why are we discussing? Big question is, why are we discussing pulp calcifications? Is the pulp calcification friend or foe of a clinician? So it's very clear that pulp stones may be associated with some systemic pulpal disturbance, but there exists no firm evidence to prove that. But if the pulp stone is present in the pulp chamber and the canals are calcified, it is very, very difficult to perform a root canal treatment. And this is the reason why we are here today. And in certain such cases, it takes more time to find a canal rather than shaping them. I'll be discussing some of the cases where it took me two complete visits to find just a root canal orifice. Okay. So it's necessary that we discuss the challenges that we face while dealing such cases. Okay. So for me, it is both friend and foe. Friend in the sense, if you can deal with such difficult cases, you can make extra money out of it by charging the patient more for such cases, right? And foe in such these cases are so difficult. So sometimes if you are not planning the cases and not executing the cases in a correct way, you may land up yourself in a very difficult situation, right? So now, what are the challenges that we face with the calcified cases? I have divided the challenges into three parts. The challenges we face while we do the access opening, challenges we face while we are locating the canals, and challenges that we face during the shaping of the canals. Before jumping to that, okay, dealing with such cases needs to have certain kind of magnification. And I would like to tell you that when we are dealing with such cases, we need to have certain kind of magnification, either in the form of a loop or in the form of a microscope. But it's really understandable that not every person and place in this world have the access to microscope and such tools and technologies. Okay, but at the same time, we have to understand that some of these tools are very effective and helpful in achieving success in such extreme calcified cases, and especially in the molars. So without those, it's no surprise that some of the people find it difficult finding the canals and negotiating the canals in such cases. And we must not be expecting so much from ourselves when we are at the situation like that. So it becomes utmost necessary and mandatory for us that we learn about the pulp as well as root anatomy. Additionally, we need to have adequate amount of magnification and illumination so that we can differentiate between the primary, secondary, and the tertiary dentine. Okay, so when you are going for magnification, you can have microscope in your clinic, or you can have a loop in your clinic. Loops are again of two types basically. The